are with the big story, and we are continuing to give you minute-to-minute updates regarding coronavirus. And this is the latest now that's coming in from West Bengal. Bengal Chief Minister Mamata Banerjee has ordered for cinema halls to be shut in the state. This situation will be reviewed on the 30th of March. There is to be closure of educational institutions extended till the 15th of April. Remember, this was already shut, but the date of which has now further been extended to 15th of April. Added to that list is now cinema halls as well to be shut in the state. And there has just been an update coming in from just a short while. The total number of cases of coronavirus in India has further gone up to 114. State of Uttarakhand has also reported its first coronavirus case. But amongst all states, Maharashtra continues to be the one with the highest number so far, 32 positive cases. Government of India in an early meet today decided to further intensify its fight against the spread of the virus in tripling up testing facilities. Also, what is being advised time and again is social distancing. But it's a case of selective isolation prioritized by states. While several states have shut schools and colleges, there are exams, specifically CBSE, that are on as per schedule. For now, there are states of Kerala, Karnataka and Assam, and more lately Maharashtra, who have decided to cancel exams as well. Let's get in further details. We have with us our correspondent Ayushman with those inputs, but more importantly, the breakdown of what is available right now. Ayushman, with the total number of positive cases across the country now going up to 114.
Exactly, Sahar. After yesterday night, the Ministry of External Affairs has finally released the data for today, and 4 new cases have been reported, and Odisha has got its first case of positive of coronavirus. Along with that, we have Jammu Kashmir, Ladakh and also Kerala reporting one cases each. So the overall number has now gone up to 114. At the same time, if you talk about the discharged patient, they are 13 in number. So far, the number has been going up. We have seen significant development yesterday, rise in the number if concerned. And today, 4 new cases. So far, it was expected that at 4:30, the briefing was there of the group of the ministers, whatever decision was taken. But after that, it was said that 5:30 the briefing will be there. Now it has been said that it will be at 6:30. So official declaration of what all has been discussed in the meeting hasn't been done yet, sir. But what we are getting to know from the sources is that the closure of schools and the educational institutes is there in the pipeline. The government may order that all the schools will be closed and an order will be issued in that. At the same time, the examination, which is CBSE examination, which is going on right now, for that certain protocols will be followed so that there is an ample distance between students sitting for examination. Also, for if you talk about the if you talk about the situation of work from home, they have said that the few people, industry people have been also told that they should work on this module as to they should allow for work from home. But so far, we have been told that the press conference, which was scheduled to take place at 5:30, will now be taking place at 6:30.
Right. Ayushman, if we have more details in the announcement that came in earlier, looking at the increase in number of cases, it was being asked as far as testing facilities are concerned. We're now going to be getting a triple of what was existing, about 52 testing facilities. But is this going to be all across the country or still centered only in the big metros?
Well, sir, looking at the current stage, we are in the second stage of this coronavirus outbreak that we are witnessing in the country. And this is the limited local transmission that has been happening. And if you talk to the officials in the senior officials in the health ministry, they are clearly saying that the third stage is of a community transfusion. And all that step, the quarantine method, the closure of schools, the closure of shopping malls, cinema halls, and all that we are witnessing right now is towards the direction that we should not go towards the the third step. But at the same time, it has been said that by mid of this week, by Wednesday, the ICMR is going to increase the number of testing facilities to 65. Whether it will be centered in the metros, that hasn't been spoken of, because the metros already have that. It is being contemplated that the other parts where we are witnessing a rise in Maharashtra and also in Kerala, these centers will be there. But so far, the ICMR has clearly said that they have got ample amount of testing kits available, and also the number is there with them when they can actually conduct these tests. But important aspect is the testing centers are likely to be increased in coming days, sir.
Right. Any word that has come in or further contemplation as far as domestic travel, domestic movement within the country is concerned? Of course, some states have already started screening at major railway junctions. But any direction that would come in from the central government here as well? Because now, since coronavirus is being spread locally, we've been isolated from the world for the past 1 week now. So to start screening domestic movement as well.
Well, sir, we have seen some states implementing this domestic screening as well at airports and the land routes as well. But so far, when we asked Civil Aviation Minister, Minister of State for Civil Aviation, Hardeep Puri, on this, he clearly did not speak because we have been pursuing this as to when the government is actually starting the domestic screening. So far, no decision has been taken, he said. And he also said the detailed briefing will be addressed in that. But so far, we have got no information as to what is happening from the center side on the screening at the domestic airport is concerned. But definitely some of the state like Assam, where one of the minister has said that at the domestic airports also the thermal screening will take place. But so far nothing has come from the center side.
Ayushman, many thanks getting us all those inputs here. And remember, our entire team of reporters there getting us minute-to-minute inputs on ground despite the current scenario there. We'll move ahead to other details coming in. And this has been an important ground check at one such quarantine center, which is in the national capital in Dwarka in Delhi. Patients have made videos and tweeted them out, complaining of shocking conditions at this center. There is shortage of food, there is shortage of water, there is no hygiene, and doctors aren't up to the mark. Times Network has accessed these videos. Patients here say that they're given half a sandwich for breakfast and biscuits for lunch. What's worse here, patients complain that doctors in the center are using one thermostat for all of them.
हमें पिछले 12 घंटे में सिर्फ एक आधा सैंडविच दिया गया है और फिर हमें आधा घंटा पहले बोला गया था कि लंच आ रहा है और ये हमारा लंच आप देख सकते हैं रस्क के पैकेट आधा घंटा वेट कराने के बाद और उससे पहले हमें सिर्फ पूरे दिन में सिर्फ आधा सैंडविच मिला है पानी भी 4 घंटे के बाद मिला है
कि एक ही थर्मोस्टेट है और सबको एक ही से टेम्परेचर लिया जा रहा है।
मैं चर्चा चलाऊंगी इसकी और मैंने बोली थी टिश्यू पेपर चाहिए सैनिटाइज चाहिए क्लीन करूंगी
डिसइंफेक्टेंट नहीं है
हो सकता है नीचे आ भी गया
और डिसइंफेक्टेंट भी नहीं है
नीचे जाऊंगी तब दूसरा स्टाफ जैसे आएगा ना वो लेके आएगा
और सैनिटाइजर
भी लेके आएगा।
अभी तो कुछ नहीं था मैम लेकिन एक थर्मोस्टेट
मैंने आप लोगों से हेल्प लेके मैं की हुई
आप लोग ले रहे हो लेकिन फिर भी आपको ध्यान है।
Not just that, patients are complaining of dirty washrooms and that one room which is congested for 7 to 10 patients, and there is shortage of doctors. Only 4 to 5 doctors for the entire quarantine center.
And we were to be quarantined in a facility in Dwarka, which is basically the police training center or something. They told us that it is going to be a clean facility and each one will be getting a single room. And immediately once we reach the facility, they will be doing our swab tests and all. It's right now 12:10 and our flight landed at 1:30 at night. Till now, there has been no test done. The facility is in pathetic situation. The bathrooms are clogged. There's no hand sanitizers at the place. Pathetic situation to live by. Stains on the bed, and they are putting approximately 7 to 10 people in one single room where everyone should be separate. If they suspect us of having a coronavirus. We have not been given anything to eat apart from a single sandwich and a bottle of water. There is nothing else.
Here the security is around 200 policemen, you can say. There are armed forces, you can see. Doctors, there are only 2 to 3 doctors in the starting. Now after putting pressure, there are like 4 or 5 more doctors.
But none of them are treating us.
Yeah, none of them are treating us. There are people in doctor's uniform. We ask them questions. They are saying we are not doctors and we don't know what to be done. In the morning at 6, when we were kept in the bus for 4 hours outside the airport, closed the doors of the bus. We were not allowed to go outside the bus. It was suffocating. Nobody was answering where we would have been to be taken. Nobody knew what would be done with us, and still they don't have any idea about what should be done with this amount of people. There are people who are not ready to come inside the facility. They are seeing this such poor condition of the facility.
This is shocking, this is concerning, and especially at the capital. This is the Dwarka police center where these visuals that we've got you from, and these are people who are actually inside these quarantine centers who have returned from Rome, Italy and other places, who have come here and who are Indians who have been put at these places because they've been asked to stay there for the next 14 days. It's an isolation ward, and if the condition of these isolation wards are exactly the way these people have explained it to us, then it's really concerning, because the state government and the center government has continuously released advisories telling that we have to keep our atmosphere clean, our environment clean, ourselves clean, and if that is the condition, if we have to survive corona, then these lapses that we see at the centers, at the isolation ward, is something that has to be looked into first, because these are the places where people where there is a suspect of positive cases are kept there, and if the places where they are kept is not kept safely, then it's really concerning. And as the problems that we've heard from them, we've also seen a visual where people who have just returned from outside, from outside the country, have been brought to these centers, and they are also reluctant to enter these quarantine centers, because they also fear that they would be better off at their places than they would be here, because they have also got a sense that these centers where they've been taken into are not hygienic anymore.
And at a time when the centre as well as respective state governments have decided to ban mass gatherings to avoid any further spread of the virus, our political leaders who should lead from the front but not so, and these are 2 chief ministers, openly found flouting their own rules. Karnataka Chief Minister B.S. Yediyurappa attending a wedding ceremony in Belgavi, which had 2,000 people in attendance, no precautionary measures except for hand sanitizers, and the Goa Chief Minister, who had himself urged political parties to not hold public meetings or mass gatherings, was himself seen doing the same. Added to that list is the Bihar BJP leader Bhupendra Yadav, in public rallies, posting all of that online as well.
It's utter disgrace that, the Chief Minister of Goa, Dr. Pramod Sawant, has been mocking and defying his own government health department's policies over the COVID-19. Couple of days back, the Chief Minister along with the Health Minister held a press conference and, set in terms took precautionary measures, saying that malls should be closed, schools are shut till 31st, the theatres will be closed. It was a good decision by the government at that point of time. But now it's unfortunate that the Chief Minister himself is defying his norms set by his own government. Since last 2 days, yesterday night and today morning also, he has been holding meetings with his, for the Jilla Panchayat polls, closed door meetings of 800, 500 people. So what is the example the Chief Minister is setting in? Being a doctor himself, he is defying his own norms and he's going on, conducting meetings.
Let's get you more ground inputs with our team of correspondents continuing to get us the latest despite the circumstance on ground. We have Pramod from Chennai at a medical store. Our correspondent Disha, who's at the Bhakti supermarket. This is in Powai in Mumbai. First to you, Pramod, this is of course with respect to basics that are not available in many medical stores. What is it that you're getting us from here?
When it comes to Tamil Nadu, the state government is constantly saying that everything is under control and it's being managed. And in fact, they only claim that so far there's only been one patient who has been COVID-19 positive, and even they claim that that particular 45-year-old male who had a travel history of coming back from Oman will be discharged today after a brief period of observation as well. But however, when it comes to like medical shop, just like you mentioned, the bigger problem here seems to be that people are definitely worried, which we can see at this point. In fact, there is a larger requirement for masks and sanitizers, and I have the owner, owner of the shop. And sanitizers and mask இது பண்ணும்போது இப்போ எவ்வளவு இருக்கு, என்ன ஷார்ட்டேஜ் பாக்குறீங்க?
இப்போ வந்து எதுவும் ஸ்டாக் இல்லை, 8% எதுவும் ஸ்டாக் இல்லை. ஆல்ரெடி லாஸ்ட் வீக் தான் வந்து 1000 பீசஸ் இருந்து 1000 பீசஸ் எல்லாமே க்ளோஸ். பட் அதுவும் 8% எதுவும் ஸ்டாக் இல்லாமல் இருக்கு.
Well, he claims that there were 1000 pieces last week, and within just a couple of days it's all sold right now, and at present they don't have any stock. இப்போ பிரைஸ் வச்சுக்கோங்களேன், ஒரு மாஸ்கோட பிரைஸ் முன்னாடி எவ்வளவு இருந்துச்சு, இப்போ எவ்வளவு வருது?
முன்னாடி இருந்தது வந்து 5 ரூபீஸ் இருந்தது, இப்போ வந்து 15 ரூபீஸ் 20 ரூபீஸ் சொல்கிறாங்க. ஆனால் இப்போ ஸ்டாக் இல்லை.
அப்போ மக்கள்
வாங்குறாங்க, ஆனால் பட் ஸ்டாக் இல்லை.
Well, this is a very important point you need to note. A mask was costing a price of 5 rupees, and now it has gone up to 15 to 20 rupees. People are still asking for these masks, but there is no stock. The government has to definitely take stock of this situation, but we're not exactly sure how they are handling it, because whenever we ask the state government, they claim everything is under control and they have all the stocks. But here in a medical shop, the situation seems to be completely different. Sanitizer நிலைமை என்ன?
சானிடைசர் வந்து லாஸ்ட் வீக் வரையும் ஒரு 100 பாட்டில் இருந்தது, அவ்வளோ. அதுக்கப்புறம் மறுபடியும் ஸ்டாக் கிடையாது.
எத்தனை நாள் அது சேல் ஆகுது?
அது கிட்டத்தட்ட ஒரு 3-4 டேஸில் காலி ஆகிடுச்சு.
கேட்டா என்ன சொல்கிறாங்க கம்பெனி?
கம்பெனியில் கேட்டால் ஸ்டாக் வரும், டுடே வரும், டுமாரோ மார்னிங் வரும், டுமாரோ ஈவினிங் வரும், அப்படி தான் சொல்லிட்டு இருக்காங்க. அவ்வளோ தர ஸ்டாக் எதுவும் வந்ததில்லை இது வரைக்கும்.
Well, so generally in this medical shop alone, it's a very petite medical shop, they keep a stock of 100 sanitizer bottles, and even that is completely sold out right now, and they are ready to sell the sanitizer bottles and masks, but they don't have. The only answer they've been given by the companies is that there is no stock, and it's very strange because the state government is maintaining that everyone has, there is complete stock of everything and no need to panic. But this is a situation over here. The person very clearly mentions that people are worried. இப்போ ஜெனரலா வர பப்ளிக் என்ன கேக்குறாங்க, என்ன மாதிரி ஒரு டோன் இருக்கு கொரோனா வைரஸ் பத்தி?
நிறைய பேர் வந்து கேட்குறாங்க, இது மாதிரி மாஸ்க் இருக்கா, சானிடைசர் இருக்கா, இதை வாங்கி கொடுக்க முடியுமான்னு கேட்குறாங்க. பட் நம்ம ஆர்டர் போட்டாலும் ஆர்டர் வரதில்லை. ஆமாம், அது ஸ்டாக் ஆர்டர் வரது, சப்ளை இருந்தனாக்கா, ஸ்டாக் இருந்தாக்கா நிறைய போயிட்டு இருக்கும், எக்கச்சக்கமாக போயிட்டு இருக்கும். ஒரு நாளைக்கு வந்து 1000-2000 பீஸ் கூட போகும் ஸ்டாக் இருந்ததுனாக்கா.
So like he claims that they are ready to sell. They are ready to sell even 2000 pieces of mask. But the only problem is that no matter how many times people are coming over and asking for all these materials, they only get the answer that they don't have a stock, and because of that, they are just walking away with bare hands.
Well, this is important there, Pramod, because it's very different from all the assurances, as you say, that the Tamil Nadu state government continues to make. But stay with us, please. We're getting in another input from another state in Maharashtra. This is in Powai, which is in Mumbai, close to Mumbai. Disha is at a supermarket. Disha, it's no longer what we'd seen earlier in the previous fortnight, shortage of sanitizer or masks, but now it's gone on in several cases, reported shortage of milk, bread, pulses. Are people just buying up, thinking that they need to stock up, they're going to be at home for the coming next month?
Well, sir, if we talk particularly about the city of Mumbai and specifically about the big retail outlets like D-Mart, Big Bazaar, definitely there has been an impact because there is increase in demand for all of these products as people are stocking most of these products and definitely there's a shortage of supply, and that is why most of the demand has now come to the local supermarket stores where we are. We are here at Powai's Bhakti supermarket. We'll directly speak to the owner of the supermarket here to understand what exactly is the current situation here. शुक्रिया हमारे चैनल पे बात करने के लिए. आप बताइए, आपके सुपरमार्केट में जो सप्लाईज का कुछ शॉर्टेज है, फॉर इंस्टेंस नेसेसिटी प्रोडक्ट्स जो है, ब्रेड, बटर, मिल्क हो गया, क्योंकि अभी लोग जो है वो काफ़ी चीज़ें स्टॉक अप कर रहे हैं एडवांस में, तो आपकी सुपरमार्केट में सब अवेलेबल है कि कुछ कमी है और इंक्रीज़ है डिमांड?
ऐसे तो सब अवेलेबल है, बट लिमिटेड स्टॉक अवेलेबल है, बिकॉज हम हमारे हिसाब से स्टॉक रखते हैं जो हमारे रेगुलर कस्टमर्स है उसकी. बट अभी डीमार्ट बंद होने के कारण सब डीमार्ट के कस्टमर यहाँ पे माइग्रेट हो रहे, तो उतना स्टॉक हमारे पास अवेलेबल नहीं है, बिकॉज वी वर नॉट अवेयर कि वो अभी डीमार्ट बंद रहेगा, नहीं तो हम पहले स्टॉक अप करके रख सकते थे. ऐसा है.
अभी ज़्यादा से ज़्यादा कस्टमर्स आ रहे हैं, तो उनके नेसेसिटीज़ के लिए अभी आपके सुपरमार्केट में, बिकॉज ये लोकल सुपरमार्केट है और काफ़ी रेसिडेंशियल सोसाइटीज़ आजू बाजू है, तो उनके लिए फुलफिल हो रहा है कि आपको डेली बेसिस में काफ़ी इंक्रीज़ करना पड़ रहा है आपका प्रोडक्ट?
ऐसे तो सब स्टॉक है हमारे पास, बट पर्टिकुलर कोई ब्रांड मांगता है वो नहीं मिल पाता है, तो उसका अल्टरनेट है. कहने का मतलब प्रोडक्ट सारे अवेलेबल है, बट अल्टरनेट मिल जाते हैं, जो पर्टिकुलर ब्रांड चाहिए वो नहीं मिल पा रही है।
You heard from the owner of the supermarket in concern, said that of course there are, as you can see, there are certain essential food items that we can see here which is available at the supermarket, but definitely he says that the stock which he also has is very much limited, because considering the big outlets, the stock is very limited, so most of the people are now coming to these local supermarkets to really collect food items and basic food as necessities like bread, butter, milk, and which can actually help in their day-to-day business.
That's right. Of course, the big message is no panic buying. Despite assurances that have come in from certain state governments, it is, of course, maintaining the stock, also getting in newer supplies from the back end, which isn't happening. Pramod, Disha, many thanks for getting us those inputs. Let's get you the latest. This is with respect to political crisis now in Madhya Pradesh. The BJP, which had put in a plea in the Supreme Court on the flow test. Why didn't the flow test take place today? Supreme Court has decided to hear the BJP plea tomorrow. Remember, the Supreme Court, in the wake of coronavirus, had said it would only be taking in urgent matters. So this is a plea that would be taken in by the Supreme Court tomorrow, where the BJP seeks an immediate flow test. We have with us our Deputy News Editor Meenakshi Bhanja getting us those inputs here. Meenakshi, undoubtedly the Supreme Court giving this much priority.
Well, that's right, sir. We are looking at the future of a state government which is at stake, and clearly again, as we have seen so many times play out in the recent past, such matters reach their logical conclusion in the Supreme Court. This is a high-stake legal political drama, and this is something which will go on to determine the fate of the Kamal Nath government, and therefore the issue becomes even more contentious, and again we will see the debate and arguments pan out in the Supreme Court with regards to the purview or the extent of the Speaker's powers versus that of the Governor's powers.
Yes, Meenakshi, it would be interesting to hear that when it comes up tomorrow in the Supreme Court, this has been taken up urgently, has been accepted and would be heard tomorrow. The allegation that the BJP has on why the Speaker did not go ahead with the flow test today. And with that, it is a wrap on the big story. We'll continue getting you the latest inputs, minute-to-minute updates here on the coronavirus outbreak. Stay on with us.